Professor Feng has kindly consented to work with the Silver Tsunami Asia Group to create a series of clips which will be published on YouTube and other social media for the benefit of those who are 50 plus and working their way to looking towards a simpler way of keeping themselves healthy and active in their lives. Professor, are there any simple pieces of advice that you might be able to give these seniors in terms of keeping themselves healthy medically and otherwise?
Well, yes, thank you, Bernard. It's my pleasure to be part of this Silver Tsunami movement. Now, in order to keep healthy, or as we say, this series of HealthWise articles, first of all, I think, and actually you've got no choice, is to choose your parents. If you have parents who live long, chances are going to live long. But that, of course, you have no choice. Now, secondly, is actually you don't abuse yourself. When I say you don't abuse yourself, means you don't smoke or take large amounts of alcohol. When you are sick, go and see a doctor. Go for regular immunization. Even when you're a child, you have various immunization procedures. And then when you're an adult, you go for hepatitis B, inoculation, all that. And then when you coming to about 50 and all that, you should actually go for a regular health screen. Now there are, as you say, many screening packages in the market, but basically you really need just to screen for a few common chronic illnesses. The rest of this is actually, added on. So you have to exclude things like diabetes, hypertension, high cholesterol. As far as cancers are concerned, you have to do a fecal blood to exclude colorectal cancer, and then you have to check your urine to make sure you do not have any serious kidney diseases. These are the things that the Ministry of Health recommends, and I think these are very excellent recommendations. Now, as far as screening is concerned, health screen, it should be gender specific and age specific. In other words, if you're 50, there are certain tests you need to do. But when you're 70, then there are extra tests you need to do. For example, now a lot of seniors don't go through hearing tests. Now in people above the age of 65 or 70, they have problem with hearing, so they should go for hearing tests and also eye tests. But when you're 50, you don't really need to do these things. If you're female at 50, probably you need to do mammogram once in 2 years. But if you are getting older, probably you need to do mammogram yearly. So these are variations of the theme. But basically you need certain specific tests.